Epidemiology, the basic science of public health. Based on Chapter 4 Introduction to Public Health by Mary-Jane Schneider. What if I told you that the biggest health breakthroughs didn't happen in high-tech labs, but on the streets, with shoe leather and sharp minds? Welcome to our deep dive into epidemiology, often called the diagnostic discipline of public health. In this video, we'll explore how epidemiologists track diseases, solve outbreaks, and prevent public health disasters before they begin. Stick around to hear how one 19th century doctor solved a deadly mystery using data, maps, and good old-fashioned observation. What is epidemiology? Epidemiology is often called the basic science of public health, and for good reason. It studies the patterns of disease occurrence in human populations and the factors that influence these patterns. It asks fundamental questions. Who is getting sick? When are they getting sick? Where is the illness happening? And why is it spreading? This data helps guide everything from vaccination campaigns and food safety regulations to global pandemic responses. As Charles Edward Winslow said, epidemiology is the diagnostic discipline of public health. Its ultimate goal is to use this knowledge to control and prevent the spread of disease. It helps us not just treat illness, but prevent it. But how does this work in real life? For that, let's rewind to Victorian-era London. John Snow and the Cholera Mystery. In 1854, a terrifying cholera outbreak swept through the Broad Street area of London. At the time, most believed disease spread through bad air or miasma. But one British physician, John Snow, known as the father of modern epidemiology, suspected the source was contaminated drinking water. Snow conducted what we now call a natural experiment. He collected data on every cholera death in the area and mapped them, finding most clustered near a single water pump on Broad Street. He also compared cholera death rates among houses supplied by two different water companies. The results were striking. Houses supplied by the Southwark and Vauxhall Company, 1,263 deaths from cholera. Houses supplied by the Lambeth Company, only 98 deaths. This meant the rate of cholera deaths was 8.5 times higher in houses supplied by the Southwark and Vauxhall Company. Snow didn't just stop an epidemic by famously removing the pump handle. He proved that disease could be prevented through data, observation, and environmental changes. That's modern epidemiology in action, over 150 years ago. Surveillance and notifiable diseases. Today, we don't wait for disease outbreaks to become crises. We monitor them constantly through epidemiologic surveillance. Surveillance is the ongoing, systematic collection and analysis of health data. In the US, approximately 90 conditions have been identified by law as notifiable diseases at the federal level, including HIV, measles, and Zika. When a physician diagnoses a notifiable disease, it's reported to the local health department, which then passes it to the state health department and the Centers for Disease Control and Prevention, or CDC. This timely reporting allows public health authorities to detect an emerging epidemic at an early stage, enabling them to act fast, like distributing vaccines, or, as with AIDS, facilitating the recognition that a new disease was emerging early in the epidemic. The CDC even issues a weekly publication called the Morbidity and Mortality Weekly Report, MMWR, reporting on timely public health topics. Surely the epidemiology, solving outbreaks on foot. But not every outbreak shows up first in a spreadsheet. Sometimes, epidemiology means shoe leather epidemiology, old-fashioned medical detective work. Take a sudden spike in hepatitis A cases in one county. Normally, they'd see only a few cases each year, which is the endemic rate. But a sudden increase signifies an epidemic and calls for an investigation. The epidemiologist starts asking the who, where, and when questions. Who are the reported cases? When did the first symptoms appear? And the hardest, where did the victims obtain their food and water during the period of likely exposure, and what sources did they have in common? If they all ate at the same restaurant, and the chef recently had hepatitis, you've found your source. The health department can then take steps to prevent wider exposure, like closing the restaurant if necessary. This rapid investigation put an end to the 1993 Milwaukee cryptosporidiosis outbreak, which then became a notifiable disease. Chronic disease epidemiology, Framingham Heart Study. Epidemiology isn't just about acute outbreaks of infectious diseases or toxic contamination. It also helps us understand chronic diseases, conditions that develop over long periods, like heart disease, stroke, and cancer. Until the mid-20th century, these were often thought of as a natural part of aging, with no one looking for causes. One of the most important epidemiologic studies ever done began in 1948 in Framingham, Massachusetts. Over 5,000 healthy people were enrolled in what's known as the Framingham Heart Study. They've been tracked for decades, with examinations every 2 years for the rest of their lives. From the single, groundbreaking study, we discovered the major risk factors for heart disease: high blood pressure, high blood cholesterol, and smoking. Weight gain and lack of exercise were also found to be associated with increased risk. By the 1970s, heart disease deaths were already falling in the US, thanks in large part to the public health programs and behavioral changes driven by what we learned from this one town. Smoking and lung cancer, cohort studies. Another public health milestone? Proving the definitive link between smoking and lung cancer. Mortality from lung cancer began increasing dramatically after the 1930s. In the early 1950s, two major epidemiologic studies convincingly established a link between lung cancer and tobacco smoking. British epidemiologists surveyed over 40,000 doctors on their smoking habits and followed them for years. A similar, larger study in the US followed almost 188,000 men. What did they find? Smokers were 10 to 20 times more likely to die of lung cancer than non-smokers. The more they smoked, the higher the risk. Quitting smoking significantly reduced their risk over time. Crucially, these studies found the link held true regardless of urban or rural residents, ruling out air pollution as the primary cause. This type of long-term research is called a prospective cohort study, following large numbers of people over extended periods of time. Thanks to this research, smoking rates fell, and with them, so did lung cancer deaths. From patterns to prevention. So why does all this matter? Because epidemiology turns patterns into prevention. It helps identify environmental hazards, like the toxic contaminant in L-tryptophan that caused eosinophilia myalgia syndrome in 1989. It detects new diseases early, like when perceptive physicians reported unusual immune symptoms leading to the discovery of AIDS. It reveals complex social and behavioral risks, like how your friends' health behaviors can influence your own. Without epidemiology, we'd be flying blind. With it, we have the maps, tools, and strategies to protect population health. Epidemiologic surveillance is a major line of defense, acting as the warning system that alerts communities to new problems, allowing governments to mobilize resources and implement control measures. This knowledge allows public health workers to institute measures aimed at preventing and controlling the spread of disease. Conclusion. Epidemiology is more than just science, it's public health in motion. From John Snow's cholera map to modern-day outbreak dashboards, it helps us recognize problems early, act quickly, and save lives. Whether it's monitoring diseases, uncovering risk factors, or changing national behavior, epidemiology is the fundamental diagnostic discipline that makes prevention possible. If you are inspired by solving health mysteries, protecting communities, and making a difference, epidemiology might just be your path. If you enjoyed this video, hit that like button, subscribe, and share it with your classmate or colleagues. And tell us in the comments, what surprised you most about how epidemiologists work? Thanks for watching, and remember, in public health, prevention is power.